Bismillahir Rahmanir Rahim. Our case today very interesting. Full term girl cesarean section due to breech presentation. Mother gravida 2 para 1 diabetic on insulin. There is family history of the first baby having DDH. Our baby admitted to NICU due to respiratory distress to rule out early onset neonatal sepsis, for which treated with non-invasive ventilation. During physical examination, Dr. Najat found the baby having what? There is discrepancy in the leg length and one leg shorter than the others, and asymmetrical skin folds and gluteal folds, and there is deformity of the joint. What is called this one? It's called diagnostic clinical indicator of DDH. There is another maneuver. It's called Ortillani Maneuver and Barlow Maneuver. This is joint examination screening for early detection of the DDH. So Ortillani, how to describe Ortillani maneuver? Just only hip abduction while we are pulling the thigh anteriorly. If heard the clunk, this is normal. If absent clunk sound, indicate acetabulum is not full developed. Barlow, this is click sound. So this is hip adduction, and while we are pushing the thigh posteriorly, if click sound heard, if the hip goes out of the sockets, it may dislocate it. It may dislocate. This is called Ortillani Maneuver and Barlow Maneuver. Ortillani clunk and Barlow is click. This is our impression. It's DDH, mainly in the right side, mainly in the right side. Plan of management or plan of the care. The first, radiological study, hip ultrasound, X-ray. The second, pediatric orthopedic review. Third, parent counseling. Fourth, it will be discuss the modality of the treatment and the aim of the treatment. The treatment is surgical or non-surgical, surgical or non-surgical. So the first radiological study, it will be hip ultrasound for confirm the diagnosis and monitoring the patient. It will be up to 4 months of the age. Why up to 4 months of the age? Due to limited ossification of the skeleton. After 4 months, it will be X-ray. X-ray for diagnosis and monitoring the patient. The second, pediatric orthopedic review or consultation. And the third, parent counseling for discuss the modality of the treatment. What is the aim of the treatment? Aim of treatment to delay onset of arthritis if lifted untreated last to arthritis, and also early treatment or surgical treatment, orthopedic treatment leading to negative outcome later in life. Why? Such as arthritis and avascular necrosis. So the modality of the treatment, it will be surgical, non-surgical. Non-surgical like Biflic harness or presses, hip spica, casts, traction, just only traction, stretch ligaments in the hip joint. Surgical treatment, it will be close or open reduction, hip replacement, or osteotomy or arthroplasty. What are the indication for surgical treatment if non-surgical treatment not work, or if the DDH is diagnosed at age 6 months to 2 years. The case, summary of the case, the key points. What are the risk factor of DDH? 5F. Family history, first baby, female, funny presentation, breech, and floppy infant. Why common in the left side? Left side intrauterine position of the left hip against mother sacrum, which force in adduction position. What happens if the baby lifted without any treatment, leading to pillless limp or painful limp? Child may develop pillless limp when walking to rather than heel to action and waddling walk. يمشي زي الأعرج أو البطة. Painful hip dislocation, need hip replacement. What are the diagnostic clinical indicators? Discrepancy in the leg length, one leg shorter than the others, asymmetrical skin folds, gluteal folds, and deformity of the joint. What about the maneuver for early detection of DDH? Click and clunk. It's called Ortillani. It will be clunk. If absent clunk sound, indicate acetabulum is not full developed. And Barlow it will be click sound. It will be click sound. Indicate what? Hip goes out the sockets. It may indicate dislocation. Dislocation. What are the causes of DDH? It will be femur head. It will be flat, irregular. Acetabulum, it will be shallow. It will be shallow. What is the plan of the treatment? Radiological study, hip ultrasound if the baby less than 4 months, because limited ossification of the skeleton. More than 4 months, it will be X-ray. And modality of the treatment, surgical and non-surgical. Non-surgical, pelvic harness, cast and traction. Surgical treatment, it will be closed open reduction or hip replacement, osteotomy, and indication of surgery if non-surgical maneuver is not work, and if diagnosis or DDH is diagnosed at age 6 months to 2 years. شكرا. سلام عليكم.